Are you weak on your glutes muscles and your lower body and you need to strengthen safely and effectively utilizing Pilates, yoga, and physical therapy and kettlebell? Hi, my name is Annie. I'm a physical therapist with more than 20 years experience, and in this video, I'll be demonstrating a beginner glutes activating standing exercises with a kettlebell. And my friend Gabby is here to learn. She's the beginner. And to learn more about beginner program, I have a lot of beginner playlists you can check out down in the description below. And you can also check out my core back immersion membership class for those who are absolute beginners who needed to strengthen their core safely and effectively using Pilates, yoga, and physical therapy. So we're going to begin the program in standing, and you want to make sure you warm up your hips first so you don't get injured. So most patients of mine get labral tear, injuries on their hips, their back, lifting heavy weights because they just started lifting without warming up your body. So my recommendation, you can start doing sauna, walking in the treadmill for 10 minutes at least, and then doing some dynamic stretching. So dynamic stretching is a beautiful stretching without holding the position too long. You just want to warm up your muscles, your soft tissues by gently moving our body. So let's begin the program. In standing, feet apart, place your hands on your hips. You take a deep breath through your nose. Expand your rib cage, exhale, zip it up from your lower abs, go into your navel, breathe out. Warming up your core is so important, the powerhouse of our body. Inhale, exhale, zip up. Last one, breathe in and breathe out. Now we're going to slowly lift your heels up, balance, with your feet apart, toes pointing sideways. We'll do it 5 times, warming up your toes. Your toe strength are so important to grip the floor. 2 more, my friends. Breathe in, breathe out. Zip it up as you exhale and lift up. Last one. Inhale, exhale. Well done. Now we're going to slowly squat down as much as you can to an Asian squat. If you can't do this yet by yourself, you can hold on to something stable like a chair, or she's doing great. Because sometimes we get so stiff from sitting too long, right? She's a student and she sits a lot to study. So inhale, exhale up. Warm up your hips without any weight. Right now, we have 20 pounds kettlebell, and you can start even 5 pounds for absolute beginners. Breathe in, breathe out. 2 more to go. Warm up your hips. Last one. You can place your hands in front of you for stability. Now, grab the floor and slowly twist in, internal rotation of your knee down forward, and then back down to full squat, and then switch to the other side, tapping your other knee down the mat. If you can't touch the mat like Gabby, that's fine. Hold on. And if you can just slowly internal rotation, because internal rotation is usually gets tight faster than any other part of the hip joint, because we don't really internal rotate as much, other than when you step out through a swing through during gait mechanics. In and out. So far, so good, Gabby. You feel good on your hips? Yeah. Beautiful. So this is dynamic stretching. We're moving. We're not holding it too long in one position. Last one. Well done. Now slowly stand up, and we're going to do some hip abduction and adduction. You can hold on to something stable. And for those who can balance, you can lift one leg up to the side and then in, like kicking a soccer ball. Out to the side and then in. 2, 3. You feel that stretch. You want to make sure you can really balance and hold onto something stable. So far, so good, Gabby, with balancing? Good. And then switch to the other side. Now I'm shifting my body weight to the left, lifting my right foot out and in. You might find one side a little bit more challenging, right, Gabby? So that could be the area where you have more instability. 2 more. Last one, in and out, kicking like a soccer ball. Well done. Now we're going to kick forward and back. So we're doing a multi-plane positioning because our hip joint is a ball and socket. So you want to get as much range of motion in different areas. So kick forward and kick back. You can slightly lean back and then forward. You can use your arm for momentum. So far, so good, Gabby. You feel that balance? See, when you're getting tired, you might lose balance. Good job. Now switch to the other side, kicking with your right and then back. And you can tap the floor. If you can't balance, that's fine. So you're just lubricating your hip joint. Last one. Well done. Now it's time to lift weights. So we just did maybe 2 minutes warm up, and that's fine because we're just going to do 10 repetitions on our workout. We're going to start with sumo squat. So placing the kettlebell in front of you, toes slightly diagonal. And when you go all the way down, you want to make sure you're sticking your buttocks out, pushing your knee out to the side. As you lower your hips down, grab the kettlebell. And want to make sure your neck is straight, your elbows are softened, and really pushing your buttocks out. And when you lift the kettlebell, you're gonna press down with your toes and your heels down to the mat. As you breathe in, breathe out, lift. Good. Squeeze your glutes as you go all the way up, and then slowly go down, pushing your knee out to the side, and then lift. 2. And down, inhale, exhale, lift. 3. Down. 4. 5. So far, so good, Gabby. Good. 6. 7. 8. 9. And 10. Well done. So if you have excruciating back pain, make sure you don't have that pain at that moment to do this. Do some of my Pilates, yoga, physical therapy videos to calm the inflammation first before doing strength training. I give this to my patients who are already almost graduating to my program. Now, we're going to do some deadlift. We're going to do side position so you can see how we are lifting. If you want to target your glutes, slightly bend your knees, and you want to hinge through your hips down before you lift the kettlebell. Making sure your upper back is engaged, you're not slouched down, elbows straight, soften your elbows, soften your knees. And when you look up, you're targeting your glutes. When you look down, you're targeting your hamstrings more. And today we want to target our glutes. Inhale, look up, exhale, lift. Squeeze your glutes as you lift up, keeping the kettlebell between your legs. Inhale, slowly lower it down, buttocks out, soften your knees a little bit. Beautiful. Exhale up. And when you're doing slow contraction going down, you're doing eccentric control, which means lengthening of the muscles. 3. Breathe in. Breathe out as you lift. For power. Beautiful. 5. Keeping your elbows straight. Try not to lift the kettlebell up. You don't want to use your biceps. Inhale, exhale, lift. 7. Soften your knees. And when you extend, you lock your knees. You can lock it. 9. Last one. Slow and steady going down. And thrust. And 10. Well done. And then the last exercise is squat. So for the squat, you're going to grab the kettlebell, placing it on your chest. Can you do that, Gabby? This is 20 pounds. Good. Feet slightly apart. Inhale. Exhale, squat down. Lean forward a little bit and up. 1. Inhale down. You can hold it for a few seconds down for a deeper contraction of your muscles and activation, and slightly lean forward for your glutes. And if you lean back, it's more of your quads. 2. Down. 3. Down. 4. We're almost done. 5. 6. We're almost done, my friends. 7. Gabby, you're doing great. I know it's like a HIIT workout, right? 9. This is almost like a HIIT workout. And my recommendation is doing 3 sets of 10. You can let go, Gabby. I'm just demonstrating. And you can go back again to our sumo squat first, deadlift, and squat. You can variation, but make sure you follow through the program. You can rest for 1 minute to 2 minutes in between to build muscle, if that's your goal. But if your goal is to endurance, keep going. So that's how we do strength training program. All you need is 20 minutes, 3 days a week to build muscle, especially lower body to prevent osteoporosis and falls for your balance, and then having a beautiful longevity for your retirement. And for those young postpartum women who just had their baby, this will keep you strong and healthy as long as you don't have other complications. And if you have diastasis recti umbilical hernia, low back pain, I have my Revive Pelvic Floor Health Core Rehab you can check out. Okay, let's cool down now. I'm gonna do some yoga. Let go of the kettlebell to the side. And go to the edge of the mat. Inhale, reach up to the heavens. Breathe in, chin tuck as you roll down. One vertebrae at a time. 2 forward folds. Soften your knees a little bit, Gabby. And reach down to your ankles as much as you can. Breathe in and breathe out. Hug your elbows. As you inhale, lift your elbows up to your ears. Breathe in, expand your rib cage. Exhale down, lower your elbows down, and swing it side to side. Now, reach back behind you, interlock your fingers if you can, and lift off behind you to stretch your shoulders. Because we lifted the kettlebell, and can you feel that beautiful stretch, right, Gabby?
Yeah.
So this is a good way to cool down. Cooling down is so important so you're not too sore the next day. Breathe in and breathe out. And now crawl down to the mat, monkey walk down to a downward dog. So downward dog is a good stretch. Can you feel the stretch? Hips up off the mat like a triangle, and march left and right, pedaling, pressing your heels down to the mat as hard as you can. Push down, touch your heels down to the mat to stretch your tight calves and hamstrings. Can you feel that?
Yes.
Beautiful. Inhale, exhale down to a forward plank. Lower your hips down. So this is good for your core. Beautiful, Gabby. And slowly lower your knees down before we do chaturanga. So chaturanga beginner version is when you pull your elbows down, squeezing it on your waist as you lower your chest down for absolute beginner. Beautiful. Good job. Now slowly grab the mat with your toes and back to downward dog. Press up with your hands and lift your hips off the mat to back to downward dog, like a triangle that we did earlier. Breathe in, breathe out, lift. Good. And then pedal again, left and right. Feel the stretch on your calf?
Yes.
Beautiful. Inhale, this is sun salutation, beginner program. And then exhale back to forward plank. Lower your hips down, beautiful. Lower your knees for beginner. And then pulling your elbows towards your waist as you lower your chest down. Chaturanga. Good. Grab the mat, last set. Grab the mat with your toes to downward dog. March left and right. And now we're gonna do single leg downward dog. We're gonna lift off one leg up to the heavens. Good. Inhale. As high as you can. Exhale. Place your left knee between your hands for a pigeon stretch and lower your hips down, keeping your pelvis squared. Yes. So make sure you're center. There you go. Up higher. There you go. I'd rather you have it that position than twisting like this. That's good. So it's really tight on your glutes muscles. So this is a nice cool down. After doing squats, deadlift, it gets tight. So it's important to cool down properly. So this is different from dynamic stretching that we did for warm up. So cooling down, we stay longer, right? Because we lifted the weights and then now it's cooling down. And then lower your chest down for a deeper stretch on your glutes. Can you feel that beautiful stretch on your buttocks? Isn't that beautiful, my friends? I love it. Inhale up. When you inhale up, you're targeting your hip flexors. Because Gabby, if you can check out my anterior pelvic tilt posture, she has that tightness on her hip flexors. That's why I think Gabby is hard for you to do the pigeon stretch. Because of that posture, her lumbar spine is over excessive, which means she's arching her back all the time. It makes her hip flexors tight. And then her glutes weak. But she did great today on our lifting weights today. She's amazing. Inhale, exhale down, last set. So we're holding it longer, right? Grab the mat with your right toes to slowly lift off back to downward dog. Breathe in and breathe out, lift. And then march left and right again. Pedal. Now this time, I'm gonna lift off your right foot up to the heavens for a single leg downward dog up. Inhale, exhale, place your right knee between your hands. Beautiful. Inhale, exhale down. So which one is tighter for you, Gabby? Is it your right side?
I think so, yeah.
And this is her dominant side, right, Gabby? So that's why sometimes you might feel a little bit tighter on your dominant side, and that's normal. Breathe in, breathe out, push up. Inhale, exhale down. Beautiful. Now we're going to slowly sit up to a mermaid position. So mermaid position is a good stretch post-workout. This targets your internal and external rotators of your hip, making sure your knee is level to your hip And the other side at the back as well to 90-degree position. So you're gonna feel that hip groin release, right? Can you feel that? And then just gently twist to the right, look behind you on your right shoulder as you breathe in and breathe out to the other side. Inhale, twist back and forth. Last one, my friends. Inhale, exhale. Now we're gonna switch the mermaid position. I'm placing my left knee 90-degree with my hip and my right foot back with my knee level to my hip. So I wanna make sure it's 90-90. And which one is harder for you, Gabby?
I think this side, yeah.
So that could be her right hip tightness, as I said earlier. For me, it's my left. That's where I had my injury from my car accident and everything that have more impact. And that's okay. That's why you wanna know the root of your problem, what you need to focus on. So it means you have to focus on your right to prevent knee pain. That's why sometimes when you have tightness in your hip, you ended up with knee pain. So it's the cause is usually the hip. Now we're gonna start twisting left and right. Breathe in and breathe out to the other side. 2 more, my friends, we're almost done. It's a simple workout, even 20 minutes a day makes a big difference. Or 3 days a week. You don't have to do every day if you have no time. Now we're gonna do butterfly stretch, feet together, knees out, and butterfly wings flying with your knees pulsating. Feels so good inside, right? Breathe in and breathe out. Last deep breath in, and then circles your body as you press your knee out to the side as much as you can. And rotation, breathe in and breathe out. And then the other way around. And that's it. I'm hoping you enjoyed my lovely beginner for some of you, but this is really if you have excruciating back pain, if you need my help and guidance, I have my back masterclass that I can help you safely and effectively with my lovely 8-week course. Click the link on my description below. I'll my new students and my current students are graduating soon, so I'm so excited to help each one of you who needed my expertise as a physical therapist with more than 20 years experience utilizing Pilates, yoga, physical therapy, core back immersion. Thank you, Gabby, for joining me today.
Of course.
And you might see her more often in my videos as I'm transforming her spine with her anterior pelvic tilt posture and improving her overall strength, mobility, flexibility, and overall health, right, Gabby? And if you want to join my other beginner courses, I have my core back immersion beginner program you can check out. I partnered with Train Heroic app. So it's an easy access. They have lovely encouragement there that you can get from me. And also you can see your level of intensity on each of my workout routine. It's only 4 exercises a week you can do for a month and you'll be transformed to have a stronger, deep core muscles, improve mobility, flexibility if you are inflexible. And for those postpartum women, perimenopausal, menopausal with pelvic floor issues, I have also my other course. I have 3 major courses. I know I'm sharing as much knowledge to everyone inside my channel, Instagram and TikTok and Facebook page. Check out my Revive Pelvic Floor Health Core Rehab, and I'll be admitting new students as well by May 7. If you are interested, click on the description below again and sign up with your name and email address and be part of the early bird waitlist for our first serve basis. If you have more time today, watch this anterior pelvic tilt posture video that I did with Gabby a few weeks ago. And you can also check out my episode 1 of my back masterclass to learn more about my core back immersion. Until my next video training, always remember, be safe, be well, and healthy you. Bye!